You're probably not expecting me to ask you a personal question today, but I want to know how many times each day do you go to the bathroom? And you don't have to say it out loud or to anyone near you. You can just think about it in your head. So maybe it's 4, or for some of you 5. Well, the average is about 6. And to be honest, you probably had no idea what your number was because you've never had to keep count. My name is David Janka. I'm here with Naama, Stauber, and the rest of the Compact Cath team. And today, we're here to talk to you about the people who do have to keep track. For people with a condition called urinary incontinence, many of them have to use one of these every time they go to the bathroom. This is a urinary catheter. And that means there's planning and a process involved just to use the restroom. And most importantly, they have to keep track. Now, think about that. Think about having to carry these around with you all the time. But imagine you're 18 years old and you've just gone off to college.
I want to tell you about Diego. Diego is a young college student from Southern California who was born with a medical condition called bladder exstrophy, which means that in addition to all the exciting and challenging things of being a freshman, Diego has to catheterize every 2 hours. So every time he leaves his dorm room for a day in school, he has to carry at least 6 of these with him. Look at your backpack or purse for a second and imagine, where do you put these? It's stressful. So Diego admits that with all the stress and worry, he wasn't always perfect. He would sometimes pull one of the catheters out of its package, crumble it, and put it in an aspirin bottle, for example, even reuse it. And when we talked to him, we asked him, didn't you know you're taking a risk of getting infections and even risking kidney infections and risking your life, basically? And Diego told us, of course I knew I was taking a risk. I've been catheterizing my entire life. But for me, the risk of one of my friends finding out scared me even more. And Diego is not alone. There are millions of people just in the United States who need to catheterize every time they go to the bathroom. These are people who are born with birth defects or suffer side effects of surgical procedures, got in car accidents. These are men and these are women, from less than 5 years old to more than 80 years old. It hits all age groups.
Now, today, thankfully, because of modern medical innovation, people survive the conditions that Naama's told you about, and they live longer lives than we would have ever thought possible. But the problem is, this current solution was really designed with the hospital in mind. We have a vision for the future of medicine that shifts this paradigm and that thinks about designing medical products and services that keep patients' lives outside of the hospital at the forefront. Urinary catheters have seen little to no innovation since their invention in the 1940s. But our solution changes that. So right here in my pocket, I have a compact cath. This is a small, discreet, easy-to-use, hygienic catheter solution. As you can see, it fits in the palm of your hand, and it doesn't look like something that would raise an eyebrow or cause concern like the current solution. So in here, I have one catheter. It's easy to remove from its storage disc, functions exactly the same as traditional catheters, but now, when the user is done, they can simply dial it back in and toss it in the trash. That easy. Additionally, at the tip of the catheter, we've included what we call a hygiene sheath, which prevents the user from even touching it, meaning they reduce their risk of infection greatly.
Thanks, David. So is a smaller, more discreet catheter really that much of a big deal? As you've heard before, Diego definitely feels so. But we all come from a strong scientific and analytical background, and we didn't want to make data out of these anecdotes. So we turned to research. In the largest survey that was ever conducted among people who suffer from urinary incontinence, more than half of the people admit not catheterizing often enough. Now, these people are risking not only urinary leakage, which is embarrassing and inconvenient, but also severe infection that can cause kidney infection and even a need for a transplant. So we're talking about life-risking conditions. And the #1 reason for not catheterizing often enough is lack of discretion. We believe that this product right here has the potential to change lives of people who suffer from urinary incontinence. So keep that in mind. And with that, I want to hand it to Daniel to tell you more about how we got there.
You might be asking yourself, how did this group of people come together? 2 mechanical engineers, a medical student, a business student, and myself, a neurosurgeon from Taiwan. We come together in a class at Stanford D School. We come from different backgrounds, but with similar passion to improve the quality of life for individuals with chronic medical conditions. As a neurosurgeon, my colleague and I focus on saving people's lives, but I often thought about how can we improve the quality of those lives. I treat patients who suffer from stroke, brain tumors, and spinal cord injuries. And we use a lot of high-tech instruments. However, even with the most advanced technology in the world, there were some hurdles that we cannot overcome. There were some difficulties in patients' daily life that we have no solutions for. Actually, we need something more than medical technology and engineering innovation. We need to more focus on how to improve people's quality of life. And this is the reason I come to Stanford to learn about a new patient-centered approach for designing medical devices. As a doctor, design thinking helped me serve my patients better. And now, Cath will tell you how we come up with Compact Cath, and most importantly, how our process can be applied to improve people's life.
So similar to Daniel, as an engineer working in hospitals, I also saw the need for a new approach to medical innovation. We created Compact Cath with a patient-centered design process that we believe represents a model for future design in medicine. We didn't start with a product or a technology. Rather, we started by integrating ourselves into the daily lives of our users. This started with our team and Dr. Bill Kennedy, a pediatric urologist at Lucile Packard Children's Hospital. Dr. Kennedy introduced us to a community of individuals with urinary incontinence. We met with high school students, young professionals, and even students at Stanford. And from these individuals, we were able to understand not only their explicit needs, but their implicit needs as well. For example, talking with Diego, we came to understand not only his explicit medical needs, but also his implicit needs to feel accepted by his peers, to control his privacy, and to feel like a normal teenager. This process generated insights that led to many potential solutions. We were not just looking at catheter design. From online communities to thermal urine bags, we explored a wide solution space. And before diving into any of these solutions, we first of all created prototypes that we could get into our users' hands. And for example, here you can see a picture of one of our experiential prototypes that we quickly built when we realized that the ladies on our team needed to have a little better understanding of what life at the urinal is like. So in addition to creating prototypes, we also tested these prototypes, both in and out of the hospital. And through this whole process, we sought constant feedback from our users. This pathway let us iterate upon our design over and over again so that we could ensure that we were meeting the needs of our users. And it was only after many iterations that we focused upon Compact Cath as a way to empower and improve the lives of individuals with urinary incontinence. So over the past year, we've continued to work with Diego and many other individuals to continue to refine Compact Cath into what you see today. We're currently moving forward to user testing and FDA approval so that hopefully we can get Compact Cath into our users' hands as soon as possible.
So, as you've heard, many people helped us to get to this point of being here with you today. And we want to ask you for your feedback and support in helping us make Compact Cath a reality. You see, for us, Compact Cath is just the first step. We envision a future of medicine where people from different disciplines, where doctors, engineers, business people, patients, and nurses partner together to create medical devices and services that do not interfere with daily lives, but that are designed for life. I want you to take a minute and just try to imagine the impact it can have on people's lives.
And more specifically, I want you to think about a little girl in middle school, 8 years old, who has urinary incontinence, but doesn't have to be ashamed to have a catheter close at hand because she has a compact cath. And think back to Diego, who no matter where he is on campus, can make sure that he takes care of himself because he's got a compact cath close by. And think about your grandparents or some older people you know who maybe have urinary incontinence, but are enjoying their retirement. And instead of carrying around a bunch of these every day, they can go out into the world because they've got a couple compact caths. For the millions of people with urinary incontinence, we envision a future with privacy, hygiene, and health in the palm of their hands. Thank you very much.
Thank you.